Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Let me introduce myself. My name is Natasya Anggita Damayanti. I am from medical student of Unisula University. As you can see on the screen, today I'm going to talk about fact and myth about cellulitis. On my presentation, I will divide it into four parts. The first one is definition of cellulitis, and the second one is cellulitis caused by. And the third one is the symptoms of cellulitis. And the last one is about fact and myth about cellulitis. If you have any question, I'll try to answer after the presentation. First of all, I'd like to start by the definition of cellulitis. Do you know what is cellulitis symptoms? I think cellulitis is not common in our ears because cellulitis are like itchy in our legs or in our hands. But if we are not aware with the symptoms, it might cause many complications in our body. Next, this is the definition of cellulitis. Cellulitis are common disease and caused by bacterial skin infected. Cellulitis usually happens on the surface skin, but also affect the tissues underneath. The infection can spread to your lymph nodes and bloodstream. Cellulitis can occur in both children and also adults. So if you don't treat cellulitis, it could become life-threatening. This is the picture of cellulitis. Yeah, from the definition, I say that cellulitis caused by bacteria. Do you know what bacteria are causing cellulitis? Nah, Streptococcus and Staphylococcus are causing cellulitis. These bacteria will disrupt areas of your skin, such as when you have had recent surgery, cuts, puncture wounds, atlas foots, or dermatitis. This is the picture of Streptococcus and Staphylococcus. Next, after we know about the bacteria that are causing the cellulitis, now let's move on the symptoms to identify the cellulitis. In this slide, I have 6 main symptoms of cellulitis, such as number 1 is red area of skin that tends to expand. And so this is the picture. Number 2 is swelling. Number 3 is fever. Number 4 is warmth. Number 5, red spot. And number 6 is blister. Yeah, now we are moving to our main topic of this presentation. Yeah, that is fact and myth of cellulitis. For the first one, I want to talk about the myth of cellulitis. I have four myths of cellulitis. Number 1 is skin that is red and swollen is definitely cellulitis. This is a myth, yeah, because not all the red skin are cellulitis. We have to look for the symptoms first. And number 2 is all skin infection need MRSA coverage. This is also myth because the antibiotic spectrum decision should be based on several factors, including presence or absence of virulence, severity of illness, patient-specific risk factor for MRSA, and local bacteria ecology. And then number 3 is repeat infection will not happen in patient taking antibiotic prophylaxis. This is not true because if skin is cracked, fungal infection is present or chronic edema remains, infection may still recur. And the last, redness around tick bites indicates cellulitis. This is myth. Maybe this is an inflammatory response to the bites, not cellulitis. Next, this is the fact of cellulitis. Number 1 is cellulitis most often caused by staph or strep bacteria. Like I say in the previous slide before, the cellulitis are caused by Streptococcus and Staphylococcus. But there is another type that can cause cellulitis, is Pasteurella multocida, which is most commonly transmitted to human from an animal stretch or bite. Number two is cellulitis is not the same as cellulite. Yeah, the difference of cellulitis and the cellulite are in the cause and in the place of symptoms. For cellulite, for cellulitis can be in the hand or legs or in the other body parts. For the cellulite, only in fatty body parts such as thighs and stomach. And number three is cellulitis isn't usually contagious. Yeah, even though cellulitis is bacterial skin infection, it doesn't spread from person to person. So if you have cellulitis, don't worry, but you still make sure that no one touches any open wounds on your body with bare hand or skin. The last is cellulitis can be life-threatening. Guanchi says that the primary concern for a case of cellulitis is sepsis, which is an infection in the bloodstream that can lead to shock or death. Some other possible life-threatening complications of cellulitis include osteomyelitis, or infection of the underlying bone, and necrotizing fasciitis, the flesh-eating disease that destroys soft tissues, sometimes leading to loss of limbs or even death. To quickly summarize, I would like you to remember this main point. For the first one is cellulitis, and cellulite is very different. The cause of cellulitis is bacteria, and for cellulite is the build-up of fat underneath the skin. And number two is cellulitis, not contagious disease. And then number three is not all the redness skin are cellulitis. It can be allergic or others. And then number four is cellulitis can be in fact in other body parts, but commonly in hands and also in the legs. The last one is cellulitis can occur both children and also adults. Thank you very much for your great attention, ladies and gentlemen. Do you have any question? If you don't have any question, I will close this presentation. Wassalamualaikum warahmatullahi wabarakatuh.